Our job as family physicians are to be good teammates in the healthcare system. And part of that is growing residents who are good teammates to each other. They're good teammates within the system to other specialties. They're good teammates whether they're in the office or they're in the hospital setting. And I think that that is something that really makes our program unique.
You're coming out of the program trained to be a hospitalist or a primary care doctor. So you can really fill what role you want to fill. You can choose to do something hybrid. So I think that was another thing that was really important to me as well, was having a program where you're not only doing solely primary care, but you also have a really strong hold and understanding of inpatient medicine. So it really leaves you a lot of options for how you want to shape your training, your education, and your career.
If you had asked me when I started residency, there'd be no question that I thought I was going to be an outpatient primary care physician. And now I could potentially see myself being a hospitalist. So it almost makes it difficult to decide because I feel like I'm experiencing a lot of both.
One of the things that we stand on is that concept of continuity care in family medicine. We've worked very hard at Mullica Hill. We're really proud of the fact that we have our own service. We have our own inpatient service where residents send patients from their continuity clinics to that inpatient team. And there's nothing that makes the patient feel better for a resident to say, I'm Dr. So-and-so, and I talked to your doctor in the office.
This is like a true family medicine program in terms of continuity, because we have rotations in the emergency room, urgent care, the clinics, as well as the hospital. We also have rotation in specialty clinics. So even as an intern, you start building your panel, which is really unique. So even though you will be precepting with an attending, again, you are the doctor. Your name is actually on the door of your clinic.
Over the years, I definitely feel like I've grown a lot more comfortable, both in my knowledge as well as managing patients and such. And I think that that's largely due to the program and how supportive the administration has been, Dr. Vermeulen, Dr. Davis, as well as the teaching.
If we have a resident who says, gosh, I'm really interested in sports medicine, what are the electives that I can do and how do I grow in learning point of care ultrasound? We'll do our best to make sure that they're getting as individualized learning experience as possible while maintaining the standards of accreditation from the ACGME.
Inspira has a sports medicine fellowship, so I'll be able to work with the people who are in the fellowship. I'll see what it's actually like to be a sports medicine fellow and see if that's something that I'm interested in doing.
If I'm working on a team, even if it's a younger resident, so it could be a junior resident, even if it's an intern who is like, hey, I want to do urgent care. If I have questions about something that would be mostly managed in urgent care and, they've expressed that interest, that's usually the track that they're going on, they now become the subject matter expert. So it's always nice to have that diversity of opinions.
There's so much data that shows that patients do better when they are cared for by a physician they identify with. There's so much data that says representation matters. And I'm really proud of the fact that that's part of our core value: identity salience, intersectionality, how do we learn from each other? How do we grow with each other? And yet we're still able to say we're training clinically competent physicians who are also culturally humble.
I don't feel any different than anybody else, which I guess is the whole point of diversity. I feel comfortable, I feel safe, I feel like I belong, I feel welcomed.
I'd say this is kind of like a mix of in between, where you have that, you're pretty close to Philly, and even New York City is not too far away either. But at the same time, there are more rural areas in South Jersey as well.
You're seeing some low-income patients and you're seeing some high-income patients and somewhere in between, and you get to see the differences in how those patients understand what they're supposed to do. You get to understand the lack of resources some patients have, and it forces you to be creative in your treatment plans. It definitely could be stressful sometimes, and I think it's important that residents have some way of decompressing and sort of shedding what happened during the day off.
One of the questions we regularly ask our residents is, well, what does wellness mean for you? What does support look like for you? So in terms of well-being events, we have large group events. We had our annual end of the year / beginning of the year lake party and barbecue.
The program definitely has wellness activities, wellness days where we kind of unwind after the shifts, and it tends to be a time that's allotted where we can all kind of hang out together, because you may not necessarily see all your colleagues just because of the way your rotations are.
We're going to work as hard as you are at you being successful, and once you're here, you're part of the team. You're part of the family. we will do whatever we can within our bounds of accreditation to say, okay, I'm going to try to make this work for you.
You will truly end up where you're meant to be, and you will get there, and you might be nervous the first day or the first few days, but you will truly figure out that this is the place you're meant to be, this is your fit.
If you seek out your support system, you identify your resources, and you really put your head to it, then it's only up from there. When you are starting out, there is no other way to go but up.